Hello, and welcome back to the Bryan Laskin podcast. I'm excited that you're here, and this podcast is going to be about something that I believe dentistry and healthcare in general desperately needs right now. It is about taking back the order of care, because right now healthcare is full of different systems that were designed around administration, billing, insurance, organization, operations. But the most important thing in healthcare and dentistry right now is actually simpler. It's much simpler. It's trust. It's the patient's trust. Trust among our teammates and our teammates with our patient. And when trust is strong, patients accept treatment. They return for care. They refer their friends and their family because they trust us, right? And when trust breaks down, something very predictable happens. Patients delay, patients disappear, and organizations struggle to scale. And my friends, right now in dentistry, DSOs, larger groups, they're struggling to scale. And why? I think we just hit on the core issue. It is a patient trust issue. So that brings us to today's topic. Something that I think almost every DSO executive, a practice owner, anybody in healthcare who's leading somebody in some way, any healthcare leader will eventually run into. That scaling dentistry, because scaling healthcare in general, is incredibly hard. Not growing. Growing is actually the easy part. You can acquire practices, which is very easy to do, right? Marketing can attract patients. Hiring can expand teams. But scaling dentistry consistently, that's where things get complicated. See, over the past decade, I've been working with several DSOs, and I've seen an explosion of many of them, right? There's hundreds of new organizations, thousands of locations, millions of patients we're talking about. And many of these organizations are incredibly well run. They have smart leadership. They have sophisticated operations. They have a lot of capital support, right? There's big PE money coming into dentistry. But if you talk honestly with any DSO leader, you'll hear the same frustration again and again. Two offices inside the same organization can perform completely differently. The same brand, many times, the same logo, the same marketing team, wildly different results, different case acceptance, different recall rates, different patient satisfaction, and different treatment completion. And the leaders start to ask a very important question, which is, what the hell is happening, right? Why is there this difference between these 2, 10, 40 locations? Well, scaling dentistry isn't about adding locations. It's about scaling trust. Okay, you can scale buildings, you can scale marketing easily, you can scale hiring, but if the patient trust isn't consistent, the results will never be consistent. So imagine something very simple. A patient visits 5 different offices in the exact same DSO, the same leadership team, same marketing team, same organization, same brand promise, but the experience can be completely different. In one office, the dentist takes time to explain treatment differently. The patient sees images. They can answer questions very, very, very thoughtfully. They're not condescended upon. Patients understand what's happening, and they feel confident in the care that's being delivered. So they schedule treatment, right? Then obviously, if you can imagine a second office in that same organization where the dentist is rushed, the explanation is quick, just trying to get the patient out the door, right? The patient hears a lot of terminology they don't understand. They get that glazed look that we all see all the time, right? Financial conversations happen quickly, if at all, right? So the patient leaves thinking, I don't know if this is urgent. Maybe I should wait. It's the same, same dentistry between the same locations. Could be the same diagnosis, but completely different outcomes, right? And the difference isn't about clinical skill. It's about clarity. And it's about confidence. See, dentistry has historically evolved as independent practices, right? We all know that. There's still obviously a massive amount, maybe even the majority that are independent practices today. Each dentist had their own they had their own style. They had the systems that worked for them, their own communication approach, their own way of presenting treatment, their own way of leading the team. And when practices were small, that worked. But when DSOs come in and they acquire practices and they want to scale to something bigger, well, they're trying to scale patient experience across dozens, hundreds, sometimes thousands of locations. And when patient communication varies that wildly between offices, the results They vary wildly too, right? One office creates clarity, another creates confusion. One office builds confidence, another creates hesitation, and the organization ends up with a massive variability in performance, right? So let's look at the economics of that variability so that if you're growing one of these organizations, or even if you only have a single location, frankly, this variability is across individual locations. We just didn't feel it because we're under the same umbrella, right? So imagine two practices inside the same organization. Practice A, case acceptance of 70%. Practice B, case acceptance of 35%. Now, I know what a lot of you are thinking, I'm that 70% office, right? uh, well, I would say 100% of dentists that don't know their true case acceptance over exaggerate by case acceptance by a lot. So if you don't know your true case acceptance rate, and I don't mean on 0 to 100 cases, like dollar cases, your entire case acceptance rate, that would be, reach out to us. We can help you out there. But if one has a 70% case acceptance rate and one has a 35% case acceptance rate, they have the same procedures, the same clinical standards, the same patient demographics. They could be right next to each other, the same insurance environment. But practice A is producing nearly double the treatment completion. And over the course of the year, that difference represents millions of dollars, let alone all the good you're doing for all of those patients, right? Because we are in the business of treating people, elevating their oral health. And in that 35% office of case acceptance, what have you done? You've let down 65% of the patients that actually need the treatment that you're recommending, right? But this financial gap is just the symptom. The real issue is obviously deeper. One office to get those patients the care that they need is creating clarity and confidence, and the other is likely sowing uncertainty. So here's where things get interesting. Dentistry has invested billions of dollars in technology, practice management systems, imaging systems, CAD systems, AI, obviously now the topic of the day, workflow software, but most dental technology was designed for a very specific thing. Something like billing or documentation, insurance workflows, claims management, compliance, all important things. But very few technology in our industry has been designed around something critical: patient understanding, getting the patients clear and what the treatment that we're doing. So that brings us back to the simple operating truth that I've been talking about on this podcast recently: care more, make more. When organizations consistently deliver three things: connection, clarity, and confidence, patients trust the process. And when patients trust the process, they accept treatment. They return for recall. They refer others, not because they were pressured, but because they understood. So we want to provide that clarity to our patients. Now, as we're doing now, from now until the foreseeable future, meaning when I want to stop doing this, we're going to do what's called the CEO diagnostic for this episode. The CE diagnostic is, if you're the leader in your organization, if you are the engine driving the organization, how would you apply this knowledge? So if you lead a dental organization, ask yourself these questions today. Which offices in your organization create the most patient clarity? Which offices have the lowest case acceptance? And do you know why? Why do they have that low case acceptance? And how consistent is the explanation of treatment across your organizations? If a patient visited 5 of your offices, would they feel the same? Because if patient clarity varies wildly between locations, your organization isn't scaling dentistry, it's scaling variability. So dentistry has incredible clinicians. We have incredible teams. We have incredible technology. But scaling dentistry isn't about adding more chairs. It's not about adding more people. It's about creating systems that consistently deliver connection, clarity, and confidence. Because when patients feel and they understand their care and they feel cared for, they trust their care. And when organizations show they care more, they naturally make more. And ultimately, that's how dentistry begins to do something bigger, right? That's how we start to take back care. So I think we as clinicians and we as leaders in the dental industry need to bring caring back into the equation. Less about the cool doodad or tool that can do X, Y, and Z. But when you're evaluating technology, when you're looking at implementing, when you're looking at your organizations, look and say, how consistently do we make people feel cared for? So that's this week's episode of the Bryan Laskin podcast.